working in the spirit of the Golden Empire. This is a 17 News Break.
Good morning from the 17 Newsroom. Good to have you with us. I'm Maddie Jansen, and we are breaking into regular programming for the weekly update from county officials on the COVID-19 crisis here in Kern County as they announce another 67 new cases today, and Kern prepares to move into the red tier. Let's listen in. This is Megan Pearson, Chief Communications Officer.
Slowly and carefully as I can. First, today we have the federal site is here at the county admin building. The address is 1115 Truxton Avenue. It's actually in the parking lot behind the court building, and it's here until 6 p.m. Tomorrow, it will be at Heritage Park, and that's on Mount Vernon Avenue, right next to the Richard Prado Center. On Monday, October 12th, it will be at the Department of Human Services, and that's at the corner of California Avenue and Union Avenue. Again, that's always from 8 to 6 p.m. On Wednesday, it will be at the Park Place Senior Apartments, and that's October 14th. And then on October 15th, it's heading up the hill to the Fraser Park area. It'll be at the Pine Mountain Club Property Owners Association on Thursday, October 15th. And on Friday, October 16th, it will be at the Mountain Communities Family Resource Center. A quick reminder about this federal mobile site. If you're interested in testing, the website is doineedacovid19test.com. It's also important to note that that website will only show you the next 7 days of locations. So if you are looking for a site, for instance, possibly the Friday, October 16th testing location, it may not display yet because it does only show the next 7 days of locations. I want to remind everybody, if you're in the downtown area today, to please come to the county admin building. Again, it's in the parking lot behind the court building. I actually went and did a test this morning. I would encourage you to do an appointment at the website. It took me 4 minutes, and it's incredibly easy. So you'll sign in. They'll head over to the nurses station, and they'll hand you a swab, and you'll break it open and you'll swab yourself on both sides, put it back in the vial and close it up and drop it in the bag. It literally only took me 4 minutes, so I would encourage you to do it. It's really quick. It's not the test that goes all the way up your sinus cavity. It is just the mid-range test, so it's very easy to do. We also have all of our other free testing sites, and I know it's been a while since we covered these. So I'm going to go through these one more time so that you're aware of where all of our testing sites are available. Our first one is at the Arvin Public Health Building. That's at 204 South Hill Street in Arvin, and they're open Tuesday through Saturday from 7 a.m. to 7 p.m. Next is the Wasco Library at 1102 7th Street. They're open from Tuesday through Saturday, 7 a.m. to 7 p.m. And then the next location is the Rosamond Library at 3611 Rosamond Boulevard. And their hours of operation are Tuesday through Saturday, 7 a.m. to 7 p.m. We also have a location in Oildale at the Good Samaritan Hospital. At 901 Olive Drive in Bakersfield. They're open 7 days a week from 6 a.m. to 2 p.m. The Taft West Side Healthcare District on 100 East North Street in Taft. Their hours are Tuesday through Friday, 9 to 1 and 3 to 7, so they take a break around lunch. And on Saturday from 11 to 3. The Delano Adventist Regional Medical Center is at 1401 Garces Highway in Delano. Their hours are Monday through Friday, 8 to 5. The Kern Valley Hospital is located at 6412 Laurel Avenue. And their hours are on Wednesday only from 7 a.m. to 2 p.m. We also have a location in Tehachapi at the Adventist Health Tehachapi Valley. That's 1100 Magellan Drive. Their hours are Monday through Thursday from 10 a.m. to 2 p.m. And last we have the Lamont Kern County Library. The address is 8304 Segru Road in Lamont. The hours are Monday, Wednesday, Friday, and Saturday, 9 to 2. And then on Tuesday and Thursday, they're open from 2 to 7. That's all I have on testing, and I'll turn it over to Bryn Kerrigan from Public Health.
Thanks, Megan. As Megan said, my name is Bryn Kerrigan. I'm the Assistant Director for Kern County Public Health. This morning we're announcing 67 new cases and no new deaths. While the health equity metric that was released by the state last week, Kern now has to meet 3 metrics in order to move forward to the less restrictive tier. These 3 metrics are the adjusted countywide case rate of 7 per 100,000 population or below, countywide testing positivity rate of below 8%, and a lowest quartile aggregate testing positivity rate of below 8%. As of Tuesday, October 6th, Kern was in Tier 1, or the purple tier, or the most restrictive tier. However, we met the Tier 2 metrics, or the red tier, or a less restrictive tier. Our case rate was 5.1. Our adjusted case rate was 5.5. Our testing positivity was 4.7%, and our lowest quartile aggregate testing positivity rate was 6.2%. If we remain on this track and continue meeting the Tier 2 metrics next week as well, the county could officially be within Tier 2 as early as October 13th, 2020. As a community, we have made so much progress in reducing the transmission of this disease in Kern County. However, now, more than ever, is the time to remain diligent in our efforts. We not only need to continue practicing our COVID mitigation strategies, including wearing a mask, avoiding gatherings, staying home when sick, and practicing good hand hygiene, but we must also keep our overall health as good as possible. As the COVID death data revealed, 97% of Kern's COVID deaths had at least one underlying health condition. This information tells us that you are significantly less likely to suffer severe illness or death from COVID if you are in overall good health. Some simple ways to achieve overall better health is through regular exercise and healthy eating. I'd like to close my comments again by once again encouraging everyone to get a flu shot. Getting a flu shot is an easy, free, and safe action that we can all take to keep ourselves and our loved ones healthy during the COVID pandemic and to preserve our healthcare resources. Our department is offering free flu vaccinations. For more information on when and where to obtain your free flu shot, please visit our website at kernpublichealth.com. Thank you.
Good morning, everybody. I'm Ryan Alsop, the County Chief Administrative Officer. We've tested over 200,000 residents in our community for COVID-19 over the last 7 months. We have 32,741 residents who've tested positive for the virus to date. We, as Ms. Kerrigan mentioned, 67 additional new cases that we're reporting out today. 32,309, or nearly 99% of everyone that's tested positive has either fully recovered, is presumed fully recovered, or they are isolated at home, recovering, treating their symptoms on their own. This is a statistic that has been consistent since the beginning of this pandemic. Today, 46 people in Kern County are receiving some form of care in an area hospital. Ms. Kerrigan covered the state metrics, so I won't go into detail on any of that. We are doing well. Our numbers continue to come down. We are meeting case rate numbers and overall testing positivity rate numbers, and we are meeting the state's newly most recent announced metric of the lowest HPI quartile. We're meeting that today. We are encouraged that our overall testing rate continues to come up and increase, and we are pleased with that. That's a tribute to the work that is being done in this area. by the county and all of the partnerships that we have in the community. And it is a testament to all of you and all of our residents who understand the importance of getting that done and getting out and getting tested, understanding the link between overall testing and getting our businesses and our schools open quicker. A couple of comments on our Kern Recovers program, financial assistance for county nonprofit organizations. We are distributing grant money for area nonprofits. You can fill out a very simple application at kerncounty.com. We're encouraging all our nonprofit community to visit our website, kerncounty.com, to apply for this financial assistance. We have millions of dollars available in that bucket for assisting your organization. We encourage you today to go to our website to find out more about that. Our free PPE support for small businesses continues at a very robust pace. We have distributed free personal protective equipment to nearly 2,000 businesses across the county, across 70 different industries, impacting over 46,000 employees of those businesses, providing them with PPE at no cost to them, a 2-week supply. If you run out, you can come back and get an additional 2-week supply. We have 16 locations throughout the county. This is very easy to do and to pick up. We ask you to go to kerncounty.com to get more information on that, to find out where the nearest distribution site is to you. It should be very close. We've put a lot of work into this, and those of you who are interested in finding out, how many masks and gloves and product that is being distributed, you can follow that in real time at kerncounty.com. You can find out who this is going to, which industry, where they are, how much, etc. So you can find all of that out at kerncounty.com. We encourage you to go there. Some final comments on state metrics. Ms. Kerrigan discussed them on Tuesday. The state announced that Kern County is poised to move into the next less restrictive tier of the governor's blueprint for a safer economy. Moving into this next tier, the red tier, it's the red color-coded tier. There are 4. That's going to allow for the immediate and increased, however limited, reopening of indoor operations for our restaurants, our gyms, our places of worship, among others. Importantly, it will also set the stage in our community for our schools to begin reopening for in-classroom instruction, particularly for our high school kids, and I have one. If your county, if our county is moved into the red tier next week, October 13th, a 2-week clock begins for schools to follow. If we maintain our numbers following the announcement on Tuesday for 2 consecutive weeks, our schools are able to get our kids back into the classroom. So we need to maintain our numbers. Obviously, kids will be moved back into the classrooms at schools with adaptations and under state public health guidelines that will ensure that we are bringing our kids back, our staff back, teachers back, in a way that ensures maximum safety and ensures that it's done responsibly. And so we are encouraged that we seem to be moving in that direction to get our kids back into school. Our goal today, as I've said before, we're taking these tiers one step at a time. Our goal today is to move into this next less restrictive tier, this red tier. Once that is done, we will continue to work as a county team and with all of you, all of our residents, and all of our business community toward moving into the next tier, which is the orange tier, which provides for an even greater reopening of our businesses, indoor reopening of our business community. Despite the recent changes in goals and objectives from the state, we will adapt, we will adjust our work to ensure that we are doing all we can to get our businesses open and our kids back in the classroom. We're going to be focused as a county on increasing testing. We're going to be focused particularly in those areas of our county with uniquely high positivity rates going forward. And, although our numbers are improving, it's very important that we all understand that we've got to sustain the efforts that we're putting into this and the work that we're doing as a community to keep these numbers moving in the right direction. The state announced on Tuesday, many of you may not know, that Fresno County, who recently moved from the purple tier into the red tier, the next less restrictive tier, is poised to now move back to the purple tier as soon as October 13th due to their metrics that the state is monitoring them on. We don't want this to happen, and I'm sure Fresno is fairly irate about that, I would imagine. But we don't want that to happen here in Kern County, and we're going to be working to make sure that it does not. So we need to maintain our focus as a community on keeping our numbers going in the direction that they're going, our focus on lowering case rates, lowering positivity rates, ensuring that we're doing all we can in certain areas of our community that have these high spiked positivity rates, ramping up the numbers of testing because that is tied to when and how businesses in our community may open. And we're going to be focused on this going forward. Again, we want to thank all of you in the community, everything that everybody is doing, whether it's the members of the media who continue to put out messages encouraging people to practice good, make good public health choices, our residents continuing to make good public health choices, doing all the things we've been talking about to help slow the spread of this virus in our community, our business community. And as we know, it's not everybody, but it's most, the vast majority of our business community. We thank them for everything that they're doing to make sure their employees and their customers are safe when engaging with those businesses. We appreciate it. We ask you to keep it up. We know you're doing so under very, very difficult circumstances. We are working to get you open as quickly as possible. We are responding in a very fluid environment to ever-changing state objectives. And again, we are adapting and adjusting and prioritizing based on those changes the very best that we can. So continue to be vigilant. Thank you for your support, and we are happy now to answer any questions that you might have.
Thank you, Ryan. Our first outlet is Valley Public Radio. I believe we have Carrie Klein on the line. Any questions? *6 to unmute. Our next outlet is Channel 29. I believe we have Tim Johns and Emily Irwin on the line, so we'll let you guys Rochambeau for who's going to take that.
Hi guys, yeah, thank you for your time for the question. Kind of just following up with some of the statements Mr. Alsop just made. I know that ultimately, so far, our data is meeting the criteria to move into the red tier, but that the decision ultimately lies with the state. How confident are we that on Tuesday we will be given the go-ahead to begin that transition into the red tier?
Thanks, Tim. We're going to have Ryan respond.
Tim, it's entirely possible that something happens and we don't meet the criteria to move into the red tier Tuesday. But at this point, Thursday, 4 or so days before, 5 or so days before Tuesday, we are highly optimistic that that we will be moved into the red tier. Ms. Kerrigan went over some of the numbers that were reported out by the state. Today's numbers look good. I think tomorrow's numbers we feel are looking good, our projections, and we're going to continue to put a good effort forward to do all the things that we need to do as a community to sustain the effort to ensure that we move into the red tier. So we're optimistic, and I think that's the best way to answer your question.
Great. And my final question, then I will cede the floor to Emily. I know in the past our testing numbers have come under scrutiny from Sacramento as not being at the state average. Over the past week or so, how are we doing in terms of addressing that? Have our numbers been raised to, are we going in the right direction towards where the state wants us to be, or are we still below the state average and our target there?
Tim, thank you for the question. We're still below the state average, and that's why you hear us continue to talk about encouraging those to get tested. So it is going up, but we are still below the state average. So for those of you who are interested, that's why we read off all of the testing locations today. And just a reminder, the free federal site is at the county admin building today.
Okay. Thank you guys so much. I'll let Emily take the floor.
Emily, did you have any questions?
I did. Thank you so much for letting both of us ask questions. I wanted to talk about the health equity metric, and I apologize for going over this again, but I just wanted somebody to talk about what our number was for that health equity metric, and if we have made progress since the last time Matt Constantine brought this up.
Yeah, thank you for the question, Emily. We're going to have Bryn Kerrigan respond to your question.
Good morning. Since the last time we talked about the health equity metric, I guess I should start with what the metric is by the state is that this lowest quartile would have a testing positivity of 8% or below. If we did not meet that threshold, then we would not be able to move to a less restrictive tier. As of last week, we were given our data to go along with this health equity metric, and we were told that our health equity metric within this lowest quartile was at 8.3%. So we exceeded the metric at this point last week. However, when the state released this information on Tuesday, we were well within that metric at 6.2%. So we are seeing improvement in these lowest quartiles.
Got it. I wanted to know if the improvement can be attributed to some of the programs that you guys have partnered with, some leaders in the community, like the Latino Task Force.
We're going to have Bryn come back and respond.
Yes, we do believe that our partnerships have had a big impact on this. Also, our continued awareness efforts, us trying to link PPE to individuals within our community, us trying to increase testing within our community, and then these community-based organizations that we're partnering with have likely had a significant impact on these numbers.
Okay, great. Thanks.
Thank you. Our next outlet is Channel 17. Bob Price, do you have any questions? Okay, our next outlet is the Bakersfield, Californian. Sam Morgan, any questions?
Yes, Megan, good morning. My question today is just about, with us on the verge of moving into the red tier, I'm wondering if the county is doing any outreach to businesses and churches and things of that nature, saying, what exactly will they be able to do on Tuesday? And if so, what has the effort been like so far?
Thanks for the question, Sam. I think that's another Bryn Kerrigan question, so give us a second while she comes back.
Good morning. We're developing that messaging as we speak. We try to talk about it in all of our press conferences and at board meetings to try to get this information to our community that we're on the verge of meeting these Tier 2 metrics for the second week in a row. If we do meet those Tier 2 metrics, we will schedule a press conference early next week to discuss the fact and celebrate the fact that we've met these Tier 2 metrics, to inform those business sectors that are impacted by moving into Tier 2 what they can now do. And then we'll also email and try to get letters out to all of these businesses based on the information that we have available to us to contact them to let them know. We also have all this information available on our website at kernpublichealth.com, and the county also has it on their website at kerncounty.com.
Okay, thank you very much.
Our next outlet is Channel 23. I believe we have Tori Cooper on the line. Okay, I'm going to go back up to the top and ask for any last follow-up questions. Valley Public Radio.
Can you hear me? Can you hear me?
We can. Is that
Okay.
Tori?
Yeah.
Go ahead.
Good morning. Okay, so we are wondering what it's going to take for public health to update the new death demographic dashboard. We already reached out to Michelle Corson last week, and she told us that there was a series of data that needs to be collected before you guys can officially update that. So considering that it's been 7 days later since that last update, can you tell our community specifically what you still need in order to update this information and when you plan on providing the next update?
Thanks for the question. We'll have Bryn respond.
Good morning. This information is being released using a model that has several parameters. Once a certain threshold has been met, which includes the number of deaths and individual traits of the individuals who have died, the information will be updated. Because the frequency of deaths is irregular and hopefully becomes more and more rare, we are not able to predict or say with certainty when the next update will occur.
Okay, let me go back to the top and we'll run through these again and see if anyone has any follow-up questions. Valley Public Radio, any questions?
Hi, yes, can you hear me?
Yes, go ahead.
Okay, great. Yes, I was wondering if the state has responded to your resolution from a couple weeks ago, expressing dissatisfaction with how they're doing case rate adjustments?
They have not.
They have not. And then my next question is, has Kern County been able to replicate the calculations that the state is doing on testing case rate, positivity rate? I know that this has been an issue in some counties, including Fresno, that they're not able to exactly tell how that's done. I know you've had some consistency problems, in the beginning too. I don't know if that's still happening.
Okay, so I just want to make sure I understand the question. You're asking whether or not we're able to replicate the same testing or results that the state is saying that they're getting.
Right. Yeah. Exactly. Specifically for the metrics on the blueprint.
Okay. We'll have Bryn respond.
Good morning. The state has shared their formulas with us. We have run those formulas based on the data that we have at our fingertips. We have come really close to getting to the numbers that the state releases, but we're not exact at this point.
Okay. All right. Thank you.
Channel 29, any follow-up questions? Channel 17?
Yeah, I had a question about the federal testing, and I know that we were having a problem before where those tests were not being counted by the state. Has that been cleared up, or where are we with that?
Yeah, I believe we have a commitment from the state that those will start being counted, but I'll have Bryn respond to that specifically.
Good morning. The lab associated with the federal surge mobile testing site is not electronically submitting lab results through the state's CalReady system used to track COVID cases. Because of this, These tests were not being used to calculate the county's testing rate, which was used to artificially adjust the case rate of when determining our associated tier or ability to reopen. As of this past week, the state allowed the county to manually submit those tests to be included in the calculation of our testing rate, while the state continues to work with the lab to get them reporting these tests electronically.
Okay, cool, thanks.
Okay, Channel 17, any follow-up questions? Bakersfield, California, any follow-ups? And Channel 23?
Megan, I have one more
Whoop,
question. I was wondering about the state model that we discussed a few months ago that said that the peak for Kern County would happen in February. Has this model been updated, and is it still showing a February peak for COVID-19?
Thanks for the question, Sam. We'll have Bryn respond.
Hi, Sam. The modeling has not changed. The peaks still illustrated on that modeling that we originally showed are still remain. However, our behaviors have changed significantly. So our actuals are no longer trending right along with that line that the model suggests will happen. So that means that our community is doing all the right things. We're wearing masks, we're physically distancing from each other, we're staying home when we're sick. We just need to continue these efforts. We need to continue the behavior changes that we've implemented to ensure that we do not hit that peak that the model shows we will hit.
Okay, thank you.
And Channel 23, any follow-up questions?
Yes, I have a follow-up question. So we don't really feel that that was answering the initial question, so I don't know if I need to pose it again, but if you could go into specific detail about what public health specifically needs within this model that you just referenced to update the new portion of the dashboard. Explain it to me as if I'm a 5-year-old so that I can further explain it to the community so that we all understand in layman's terms.
Sure, we're going to have Kim Hernandez respond.
Hi, Tori. Like a lot of things, the model has a lot of inputs, and part of that has to do with simply the number of people who die. The more people who die, unfortunately, it makes it less likely to be able to identify an individual person, and then the characteristics of those people. In our population, there are a certain number of people who are in a certain age group, and so if that is a larger age group, it makes that one individual person more difficult to identify. If that one individual person is in a smaller age group, then it makes it easier for them to identify. So all of these factors are examined in the model to say, what are the chances that in releasing this information, you can identify these individual people? We want to remember that we do know things that put us at high risk. That information, the information that's come out of CDC about people who are at high risk of severe illness or death, doesn't change based on the data we're putting out. It's something for us to continue to look at and to follow and to see that what we see locally makes sense in what we're seeing statewide and nationally, but the risk factors are already there. Actually, earlier this week, CDC updated the list of people with certain conditions who are recognized to be at higher risk of severe illness and death, as well as the group of conditions which may put people at higher risk of severe illness and death. So we'd encourage you to take a look at that so that people know. As CDC is getting more information, they're taking all of this to provide more information back out to us at the community, so that if I fall into one of those categories now that weren't previously known to be a high-risk health condition, that I'd want to know that now. And I'd want to make sure that if I fall into one of those high-risk groups, that I take all of the precautions, take some of the extra precautions that CDC recommends, and look at that. We understand that death information is important in our community. We grieve at the health department for every community member that we've lost. These are people that some of us know personally. They're people that everyone in our community, that this has affected people. And so we know this information is important. We also know that it's really important to protect the privacy of those family members. And so that's the balance that we try to weigh each time. And that's what this model is intended to do for us, so that we can provide as as much information to our community in a timely manner while still protecting the privacy of the person who passed away and their family members. So in trying to sort of explain how this model works, I want us to remember, the purpose of providing this information to our community. And we hope that it is helpful to people, that they understand that there are risk factors. We know from the data we've been able to release so far that underlying conditions play a big role. And so that if I or someone I know has one of those underlying conditions that puts you at severe risk of illness, at higher risk of severe illness or death, then we want to take all those additional precautions, and then we want to protect all of those people who are at high risk of severe illness or death. So we unfortunately can't say at what point in time we'll be able to release more information, because it depends on all the inputs. So if we have a lot of people who unfortunately die who are in the larger age groups and it makes it more difficult to identify them, we'll be able to release information sooner than if you have someone who is in a very small category where there may only be, a couple of thousand people in it, and identifying that individual person becomes much easier. So I understand your frustration, because it is a difficult concept to kind of work your, to wrap your brain around. And so that's why we're relying on this model in order for us to have confidence that we are finding that right balance. Does that answer your question?
For the most part, I feel like definitely a more detailed answer than the previous one, but I still have a follow-up in a sense of, just to clarify, what you're saying is, considering the fact that we still are experiencing additional deaths in the county, which essentially, when there's a greater pool, public health has already said, since we have more people in the death category, essentially more people dying now as compared to before, there's essentially a less risk of releasing this information. So my question becomes, if there's a smaller group of individuals dying from ages 1 to 17, is public health now telling us that they will not release that information, considering that those people are more easily identified? So in turn, public health will only update information pertaining to the age groups that have a bigger group of people who have died of COVID-19?
So that's not the short answer is no, that's not how that will work. It depends on the number of people who've died and which of those categories they fall into. We believe at some point we'll be able to release the information, but we're unable to predict the timing. Right? If I have one person who dies under the age of 17, that probably makes them easily identified. If we have, for some reason, a number of them, which would be a horrible thing to happen in our community, but if that happened, that changes the dynamic of the risk of releasing information. And so, we don't have that crystal ball that tells us how many people in a specific group, may die of it or will die of it. And so we don't know when there will be enough people where the risk of disclosing someone's individual identity is low enough, that it's accepted by this model. And so, we can't predict it. And so we continue to look at it. We want to ensure the community knows that, when we hit that point and the information that we have for this next set of information, is acceptable through the model to release, we will release it. We want to give our community the best information that we can within the parameters that we have to hold to. And so, we're not saying that we will never release any more death data, but we just don't have a time element that says we can release it every week. We're pretty sure that's not going to happen, because hopefully we have very few deaths. If we get to the point where we have no more deaths due to COVID-19, which is something we all hope for, then we have to reassess at what point can we release that if we don't see any more coming.
So are you guys going through the statistician to determine what you can release next? Is that essentially what you're saying?
That's the model that the statistician has built for us, yes.
So that you have to revisit a conversation with him each week?
No, the model.
Month?
No, the model we have, the whole purpose of building the model was so that we could then internally use the model, put in the inputs, and then see what the model says about the data and whether or not it checks the boxes it needs to that says this is acceptable for release.
Okay. I'm not going to take up too much more time. If you guys could just send me some more details on the model and how it works, I feel like the community would care to know that at a later time.
Okay. Thanks, Chair.
Thanks.
Okay, I'm going to pause for any last follow-up questions. Okay, before we let you go.
Megan?
Oh, go ahead.
Hi, it's Bob Price.
Hey.
Just wanted to ask you about Fresno County. I know we're concerned about our own county here, but I'm wondering if there are any lessons or observations from Fresno County's apparent backward step. Did they take a hit in some particular type of demographic, or what was their issue, and is there anything to be learned from it?
So we'll have Ryan respond to that.
So, Bob, Fresno has not been moved back at this point. The state announced, as they do on Tuesday, they provide us a list. And on that list, they talk about counties that are positioned to move either back or forward. Tuesday, obviously, they mentioned that Kern County, there are a number of other counties that are positioned to move from down to a less restrictive tier, and then there are also counties that are positioned, two or three, I believe, Fresno's not the only one, that are positioned to move back. I don't know the reason for that. It has to do with them not, specific reason for that, Bob, but it has to do with them not meeting the state's criteria. There are 3 criteria. We've talked about them today at length. But the lesson I take away is that the state will move counties back or order counties back and put counties back into a more restrictive tier if counties aren't meeting the governor's criteria that he's laid out for all of us to meet. So the lesson is that to avoid having the state come out and announce that Kern County needs to move back, which I believe would be a tremendous disruption to our business community and potentially our schools. I think Fresno is going to deal with that, and I'm sure they'll be hearing, the governor will be hearing from Fresno County, if not already. But that's the lesson. The lesson is that we need to continue to keep doing the work that it takes in order to keep our case rates, our positivity rates, and our particularly the Healthy Places Index, equity measure places, these pockets throughout the county, census tracts that have uniquely high positivity rates. We need to be pivoting and focused and prioritizing, making sure that positivity rates in those areas remain low. We've got to ramp up testing. The amount of testing is tied to reopening. We need to get to where the state average is. All of those things are important. So the lesson is that we need to keep our nose to the grindstone, and that if we don't, we will have to deal with the state coming in and telling us that we've got to move back. So I hope that answers your question.
It does. Thank you.
Okay, with that, we want to remind everybody to wash your hands, wear a mask, and watch your distance. And that's all we have for today. We'll see you next week. Thank you.
All right, you've been listening to a live update from county health officials on the pandemic here in Kern County. And just to reiterate, there are many places across the county where you can go to get a free test, and officials continue to urge you to do that with or without symptoms. They say that testing will help the county to reopen. It will also help to stop any spread from people who are asymptomatic with the virus. If you want to find the nearest COVID-19 testing site to you, you can go to doineedacovid19test.com. You can schedule an appointment there and see your results from any previous tests, or you can call 211. You can also go to kerncounty.com and schedule a test and find testing sites there as well. On Friday, tomorrow, there will be free tests happening at Heritage Park on Bernard Street. They are only taking a limited number of walk-ups at this free testing site tomorrow. So pre-register at doineedacovid19test.com. And this is a self-swab test. It's the kind that we've done here at our station several times over at Compassion Corner. It's very easy to do and fast. You'll be in and out. So again, tomorrow, 8 to 6, you can get one there at Heritage Park. And we will have much more on the briefing and what's going on with our county tier system coming up on 17 News at noon and 5 and 6. For now, I'm Maddie Jansen, 17 News.